Hello,
Hi.
my name is Chi Chi, and I'm your nurse today. And before we begin, can you verify your full name and date of birth?
Martha Jones, 21686.
2/16/86.
That's correct.
Okay. And today, what brought you in today?
I'm here for my annual checkup.
Okay. All right. Very good. When was your last annual checkup?
It was about a year ago.
Okay. All righty. Very good. So today we'll be completing your comprehensive health history. This includes questions about your medical background, your lifestyle, family history, and your overall wellness. Okay. At any point, if you have any questions or if you need me to clarify anything, please feel free to stop me and ask those questions. All right. Is it okay that we begin?
Yes.
Okay. All right. For my records, what is your age, place of birth, and your preferred language?
I'm 39. I was born in Boston, Massachusetts, and I prefer to speak English.
Okay. And that is the main language you speak at home?
That is correct.
Okay. And your ethnicity?
I am African American.
Okay. Very good. And what do you like to be called?
Martha is fine.
Martha's fine? Okay. Thank you. I'm just writing notes as we go along here, if that's okay.
Sure.
Okay. All right, very good. What brings you in today?
Just here for my annual checkup, make sure everything is okay.
Okay. Any issues that are going on?
Not at all.
Okay. All right. And any specific goals that you have for today with the visit?
So I just wanted to make sure that everything is working well, that I'm healthy.
Okay, yeah. We want that too. Okay. So how would you describe your overall health?
I would say that I'm pretty healthy. I eat fruits and vegetables most days a week. I try to get out and jog about 3 days a week. So
Okay.
pretty healthy.
So you're pretty active and eat healthy?
Yes.
Eat fruits and you jog how many times a week?
3 times a week.
Okay. And how do you think your health compares to when you last had your last physical checkup?
I feel that it's comparable. Yeah. No major changes.
No major changes that you've noticed?
Right.
Okay. All righty. Now, do you feel you can manage your daily activities without difficulty?
Yes, that's
Okay.
correct.
So you're not experiencing any shortness of breath, you're not feeling winded?
No, not at all.
Okay. All right. Now, have you ever been diagnosed with any chronic conditions such as hypertension, diabetes, asthma, anemia, or thyroid disease?
No, I haven't.
Okay. And any childhood illnesses or hospitalizations?
No.
Okay. All right. Very good. Have you ever experienced major injuries, fractures, concussions, or accidents?
No, I haven't.
Okay. Any history of anxiety, depression, or other mental health conditions?
No.
All right, very good. Have you ever had any surgeries or procedures, including dental surgeries or any procedure requiring anesthesia?
No, I haven't.
Okay. All right, we're going to talk about medications. Do you take any prescription medications?
No, I don't.
No? Okay. And do you take any over-the-counter medications such as pain relievers, allergy medication, or cold medicine?
I just take a multivitamin. No.
Multivitamin? All right, very good. Any other supplements you take or herbal remedies that you do?
No.
Okay. So just a multivitamin. nice a note here. Now, do you have any allergies to medications?
No, not at all.
All right. And any allergies to food or any environmental triggers that you know of?
No.
Okay. And any known allergy to latex or iodine?
No.
All right. Very good. Now, have you ever had a reaction to an insect bite, detergents, metals, or any skincare products that you know of?
No.
No. All right. Any questions so far?
No.
Okay. All right. Does anyone in your immediate family have hypertension, diabetes, heart disease, or stroke?
No.
No. Any high cholesterol, cancer, arthritis?
No.
Okay. And what about any mental health conditions or genetic conditions?
No.
All right. Is there anything else in your family's health history that you think is important for me to know?
No.
Okay. All right. Let's talk a little bit about your social lifestyle. Do you smoke, vape, or use any tobacco product?
No.
Okay. And how often do you drink alcohol?
I would say 1 to 2 times a month.
Okay. Right. And do you use any recreational drugs currently or in the past?
No, I haven't.
No. And what do you do for a living?
So I am a teacher.
Teacher. Okay, very good. What grade do you teach?
3rd grade.
Third. Okay, very good. All right. And do you think your job is stressful? Any physical strain or prolonged sitting?
No, I wouldn't say at all. Yeah.
Okay. All right. I'm pretty sure they keep you on your toes.
Yeah.
Yeah. Okay. And you don't, and the kids don't stress you. You have a good class.
I do. Sometimes people, have behavioral issues, but it's not overall too stressful at
Okay.
all.
Alrighty. Very good. So you think you manage your stress appropriately?
That's correct.
All
yes.
right. Very good. Now, how do you describe your work-life balance?
So I would say that I make sure to get out and spend time with friends and family at least once a week. Yeah.
Okay. And what would you describe your typical day of eating?
Typical day, I would say that I make sure to have about 3 meals a day: breakfast, lunch, and dinner.
Okay.
I don't often do have snacks. The 3 main meals is just enough for me, I would say.
Okay.
Yeah.
And how often do you think you eat fast food or processed meals?
I would say maybe once a week.
Okay. Alrighty. And how much water do you drink daily?
I would say that I have water, I would say twice a day, 1 full glass of water, like for lunch and then for dinner. And that's daily, yes. Mm-hmm.
Okay. And how often do you exercise?
So that would be 3 times a week. Yes.
3 times a week. And yes, you did mention you jog 3 times a week.
That is correct.
Do you do any other forms of exercise?
Every now and then I'll do some biking.
Biking. Okay. All right. And how many hours of sleep do you think you get per night?
I would say 7 to 8 hours a night each night.
Okay.
Mm-hmm.
And do you feel like you're getting good rest?
Yeah, the overall rested.
Okay. Any trouble falling asleep or staying asleep?
No, not at all.
No. All right. And how do you manage your stress typically?
I would say just relaxing at the end of the day, watching some great TV, and then of course I do hang out with friends and family at least once a week. I think that helps my stress level stay down.
Okay. Yeah, it's important to get out when you can and not get cooped up in the house, right?
Sure.
All right, very good. Now, do you feel you have people you can rely on for support?
I do, yes, that's
Okay.
correct.
And who is your support system?
The friends and family, yes.
Okay.
Yeah.
Does your family live locally here?
Yeah, they live within 40 minutes of where I live here, yeah.
Okay, very good. All right. We'll talk a little bit about your reproductive and sexual health, if that's okay.
Yeah, sure, that's
All
fine.
right. When was your last menstrual period?
I would say it was at the 21st of last month.
21st of last month.
Mhm.
And that's normal, or is there any issues with your menstrual cycle?
No, it's very regular, yes.
Very regular. Okay. All right. And then, are you sexually active?
Yes, I am.
Okay. And do you have any pain or concerns related to sexual activity?
No, not at all.
No. Okay. And when was your last pap smear?
It was a year ago.
Okay. Do you know the date?
I would say the October 10th of last year.
Okay.
Yes. Mhm.
October 10th. And was it normal?
Yes, it was.
Okay. And do you use any form of contraception?
No, I don't.
No? Okay. Do you have multiple partners?
Just the one.
Just one. Okay. Alrighty. Do you feel safe at home?
Yes, I do.
Okay. And the environment of the home. Do you have a working smoke detector, a carbon monoxide detector in the home?
I do, yes.
Okay. I like to ask that because fire safety is really important. A lot of people kind of overlook some of these things sometimes, but it's important to ask.
Definitely, yes.
Mhm. Are any firearms in the home?
No.
No. Okay. And do you wear a seatbelt every time you drive your car?
I do.
Okay. And have you had any recent falls or injuries?
No.
Do you have any pets?
No, I don't.
Okay. And have you been exposed to mold, chemicals, or any secondhand smoke?
No.
All right. Are you up to date on your immunizations?
Yes, I am.
Okay. And when was your last tetanus shot?
So that was about 2 years ago.
2 years ago? Okay. And did you receive your flu shot this season?
I did.
Good, good. And COVID vaccine?
Yes, I did that as well.
Okay. How many shots of COVID did you receive?
So far I've received about 5
5.
shots. Yes.
All right, very good. When was your last dental visit?
So that was September of this year.
Okay. Everything okay?
Yes.
And when was your last eye exam?
So that was also September of this year.
Okay, alrighty. Do you wear glasses or contacts?
I wear contacts.
Contacts? Now, do you perform monthly breast self-exams?
I do.
Okay. And do you know what you're looking for when you're doing those breast exams?
Is it the lumps?
Yep. You're looking at lumps, you're looking at any changes or noting any differences in nipple size, any drainage, stuff like that.
Okay.
And you would want to report that as soon as you notice a difference, okay?
Sure.
Good. Now, we're just going to go over your overall systems so that way I can note anything that you may notice or we may need to assess further, okay?
Sure.
All right. Now, Any fevers or chills or night sweats?
No.
All right. Any recent weight changes or fatigue?
No.
With your skin, any rashes that you're noticing? Any new moles?
No.
No. And is your skin dry or itchy?
No.
No. Are you experiencing any headaches or dizziness?
No.
Any vision changes or dryness with your eyes?
No.
No. Okay. Are you hearing okay? Any hearing changes that you notice?
No, not at all.
Okay. And any sinus issues or congestion or sore throat?
No.
Any stiffness in your neck? Any lumps?
No.
Okay. And then respiratory, any shortness of breath, wheezing, or cough?
No, not at all.
Okay. Alrighty. Any chest pain or palpitations that you're experiencing? Alright, very good. Any nausea, vomiting?
No.
Experiencing any constipation or diarrhea or abdominal pain?
No.
And when was your last bowel movement?
It was yesterday evening.
Yesterday evening. And is that normal for you?
Yes, that is
Okay.
correct.
And how was the consistency? Normal?
Yeah, very normal.
Okay. All right. Any urinary frequency or urgency or pain when you urinate?
No, not at all.
Are you noticing any blood in your urine?
No.
No. All right, good. We're almost there, okay? Any joint pain, any muscle weakness or stiffness?
No.
Okay. And are you experiencing any numbness or tingling?
No.
Any weakness or balance issues?
No, not at all.
Okay. And are you experiencing any anxiety, depression, or difficulty concentrating?
No.
All right. Do you have any questions for me, or is there anything that we didn't cover?
No, not at this time. I think everything's going well.
Okay.
Yeah.
All righty. Thank you for answering all my questions. We were able to get a good, thorough history, and we like to do that so that way we can have a baseline. And so we'll just continue to do your regular screening. So just make sure you continue. It looks like you're on top of that. So continue doing that. Continue doing your self breast exams. Those are very important to do. And you do have an OBGYN?
I do.
Okay,
yes.
good.
Mhm.
So just continue to do that, continue to stay active, and continue to stay on top of your vaccinations. And it sounds like you're doing all of that already. If there's no other questions, it looks like we're going to conclude this comprehensive health history.
Yes, that's it.
All right. Well, thank you so much for your time.
Yeah, thank you.
All right.
Mhm.
Okay. Take care.
Alrighty.